presentation. Yeah, my slides are visible? Yeah, okay, thank you. So, good evening everyone, and what I'm going to do in the next 20-30 minutes is going to take you to a journey of how today, right, as of June 2024, you can actually use technology, you can actually use AI in your own clinical practice to enhance your own clinical practice. And like Dr. Vimal very rightly said, you know, a lot of us see a lot of patients every day. We of course are very efficient in our process, but we could always do better. We could always get that cutting edge as far as our clinical practice is concerned. And I'm going to show you some live examples, of real life examples of how you can actually use your skills to a better effect to make your practice even better using AI, right? And these are, none of these are you know, futuristic thing. You know, most of these things we are going to discuss are what is available today. Some of the things, you know, are maybe under development from my end, but most of the things will be available to you. So I'll also tell you how to, you know, go about using that in a lot of the ways. So we are going to talk about AI in clinical use, especially dealing with metabolic medicine. So these are the 6 areas where you can use AI. You can use AI to make a diagnosis. You can use AI for interpretation of clinical signs and symptoms. So you have, let's say, a patient where there is a clinical sign or symptom which you're not very well versed with, you know, dealing with. It will help you interpret clinical reports. It will help you answer clinical conundrums. Let's say you're stuck with any clinical query or any challenge. It helps in dissecting clinical reports, right? So that's something which is very useful in today's practice, and when I show you the example, you'll understand why. And it'll help you in using, you can use virtual assistants or virtual agents to help your practice. So you could perhaps, you know, a lot of us may not afford a assistant in our practice. So this AI could be your assistant in your clinical practice. Now, some of you would have seen some of my slides earlier, but I actually also put some fresh content, some really nice, interesting content, some recent developments also. So do hang on to a lot of the interesting things as well, which I'm going to show you, right? So it's, trust me, brace yourself, it's going to blow your mind to the capability available to you today, right? These are all things which are available to you. And trust me, I've given this same talk several times. Every time I give this talk, I have to make updates because things change so fast, right? So, you know, if you know, we have the same discussion, maybe 6 months down the line, a lot of things will change to better. Okay, let's see how AI can help in making a diagnosis. So let's take a clinical case scenario. This is a case scenario which you know, is something which is slightly, you know, moderate in complexity, and it's dealing with a thyroid disorder. So we have this 29-year-old female who presents to the emergency department with anxiety, tremors, palpitations. She's having type 1 diabetes. She had a normal spontaneous delivery of a baby 6 weeks back, but she has a temperature of 100, blood pressure is normal, but the pulse is high. Her SpO2 is 98%. On physical examination, there is no neck pain or swelling, and rest of the physical examination is perfectly normal. And ECG shows a sinus tachycardia. Okay, so this was a little brief of the clinical case as the patient presents to the ER. Now, in the ER, some tests are done, and then, you know, there are a lot of other tests done, you know, CBC and all that. The tests which stand out, right, are that the patient has a TSH of 0.1 and a free T4 of 13.9. So free T4 is slightly on the higher side. The anti-TPO antibody is positive, and the TSH receptor antibody or TSH stimulating antibody is negative. Okay, so this is a clinical case scenario. Now, the question is, what is the diagnosis, right? I'm sure in your practice as well, you would encounter similar cases. Like I said, you know, this is a little bit moderate in complexity. You know, in fact, I asked this question to an audience of endocrinologists as well, and a lot of people did not get the right answer, right? So let's see if AI can give us this right answer. So let's say this patient comes to me, and I just, you know, write this little brief about the patient, right, you know, sitting in front of me. Let's ask, you know, whether you can directly ask ChatGPT. I'm not using any specialized model. I'm not using any custom GPT. I'm not using any kind of you know, tool. This is the regular ChatGPT which is available to you. Now, ChatGPT is from OpenAI, and it's available to most of us as free, right? So you have the free version. The problem is that in free version, you now have the most advanced version available to you free of cost, which is GPT-4o, right? So again, as of June 2024, the most advanced version available with us is GPT-4o. Earlier, it used to be locked only for paid user, but right now it is available for free user as well. So even if you're a free user, you can use GPT-4o. So you can try this. You can download the ChatGPT app on your mobile phone, or you can go to the website and try this out and try the same prompt out and see whether it gives you the correct answer. So this is now available, but of course I'm using a paid version, right? So a paid version, you can write a longer prompt and you can get a more detailed answer. In a free version, it cuts the the prompt which you can give and the usage, right? So that's the main difference as far as the current difference is concerned. So what I did was I just took this entire case scenario and I pasted it in the ChatGPT 4o window, right? So on the top you can see I've chosen the GPT-O model, which is the most advanced model. I can use an inferior model; it'll give you a slightly inferior answer, right? So what is the diagnosis? So I just asked them. I did not give any option, and here it gives you the diagnosis. Postpartum thyroiditis is actually the correct diagnosis. Now it will also reason out why this diagnosis is to correct, right? So again, one thing whenever you use AI, one thing you have to always remember, that always cross check the answer. Do not directly copy and paste or directly transfer the answer which comes from the AI to the clinical practice. Always do a due diligence, right? And even with the most advanced model, a due diligence is something which is very, very useful. So you can see it says patient had a recent delivery, patient has these symptoms consistent with thyrotoxicosis. The elevated pulse rate also suggests that. When you see the lab antibodies, the AI says that because the thyroid stimulating antibody is negative, it rules out Graves' disease. So again, you are probably dealing with thyroiditis, and because you have NT-TPO positive, remember you have postpartum thyroiditis. This is a very typical time for presentation, and they tend to have NT-TPO positive. So this suggests a postpartum thyroiditis, and again it says it gives you the example for that. It says it occurs within first year after delivery. You have a hyperthyroid phase, and generally it is painless, right? One thing it did not mean out. So we said that patient had no tenderness. So this is a painless thyroiditis, and what it says, how do you manage this? You basically have to give symptomatic management with beta blocker. And close monitoring of thyroid function, and eventually patient may develop hypothyroidism and may require levothyroxine. Now this is, if I ask this clinical case scenario to a first year endocrinology resident, he may or may not get the correct answer, and even if he gets a correct answer, he may not be giving such a nice detailed output to it, right? So you can try out different case scenarios. This is a synthetic case. You can probably try in real life cases also. You have a patient in front of you, you have the lab reports. Try entering those lab reports, try entering the symptoms, and then just your prompt should be, in the end, you can see what is the diagnosis, right? That's all you have to ask, what is the diagnosis, and then you can say in the end, I've written here, what is the diagnosis? That's the prompt, right? So that's the whole prompt, and that's all you need to do, and it is able to unlock the entire diagnosis. Now, a lot of you would have seen some third-party applications used for similar purpose. So one of them is called Glass Health. Glass Health is, we ourselves develop Endo AI. In fact, in the earlier presentation, I used to show a similar question in Endo AI. Right now, we have discontinued Endo AI, but I promise you we are going to come back with it very soon. Right? I'm almost in the finishing stages of developing that again. So Endo AI is going to be back, and it is going to give you a context-specific answer designed for endocrinology purpose, right? So we're going to be, it's going to be really good. This is a generic ChatGPT. It is a more, generic form, but even that one does very well. But you can imagine how good it would be when you give a specific, endocrinology context to it. Second very useful thing, and again you'll be very surprised by how ChatGPT is, accurate in these things. It helps you in interpretation of clinical signs and symptoms, right? Now, a lot of you would have seen this. In fact, the use of AI in retinopathy has been there for a long period of time, right? It's been there for a long time, and in fact, AI is very proficient in that. There are so many, developments which have happened. There's so many companies which provide this as a service. So a lot of you would have, purchased, a fundus camera, and a lot of these companies also provide a service where you can actually use an AI service to tell you whether the patient has diabetic retinopathy or not, and then give you slightly more advanced diagnostics also. Now, the thing is that a lot of these services are actually a little bit expensive, right? I have in fact tested them out, reviewed them. Let me tell you that it did not take me, it just took me 1 or 2 days to develop a retinopathy AI, right, of my own, which is as accurate as it could be, right? I'll show you a live example I'll show you an example of it. I'll show you, in the end, show you, open my screen and show you some of the other images also I recently uploaded to show you an answer, right? So this is retinopathy AI. Okay, it currently we have locked it to it's not available online, right? In fact, you can do similar thing on ChatGPT 4o also, but it will be not as accurate because you have made some custom changes and made some corrections there to help to make this more accurate. But as of now, right, if you since you do not have access to retinopathy AI, which is I'm still developing it, but of course I'll make it available soon. It would be a good idea to even test out the same thing in GPT-4o, right? Now here, AI uses a tool called computer vision, right? So it is able to see the image, able to deduce some sort of, it give an analysis of the image and then give you an accurate answer. So it can actually make a diagnosis, right? It's not, so you can see here, this is a fundus photograph. Now you can see some cotton wool exudates, right? You can see, some hard exudates also over here, right? So this is some microaneurysms as well. So this is a typical something like a a non-proliferative diabetic retinopathy broadly, if you see this, right? So the answer, we expected. I took this particular image because this image was actually kept as a spotter in one of the endocrinology mock exams which was conducted for DNB. So this image was kept, right? So we asked the endocrinology exam going students to answer this, right? And what we expected that the student should answer that the patient has microaneurysm, hemorrhage, some venous bleeding, hard exudates, soft exudates, and ultimately the diagnosis would be a non-proliferative diabetic retinopathy of moderate to severe intensity, right? So let's see if the retinopathy AI is able to make this as a diagnosis. So like I said, we're still developing it, right? So you can see this. So I'm just uploading the image over here, right? This is the image which is there, right? So it takes a few seconds to upload it. Okay, and then click next, right? Sorry. Yeah, and you click next and you can see here it's giving you the diagnosis, right? It in fact takes just a few seconds. So here it says there are hard exudates, which is correct, cotton wool spots, microaneurysm, hemorrhages, yes, correct, right? Gives you the diagnosis based on the identified finding. It is diabetic retinopathy, non-proliferative diabetic retinopathy. Then it also starts looking at the classification of the non-proliferative, and here it says these are the findings. So it is moderate NPDR, right? And here is the final diagnosis based on the findings. Your patient has non-proliferative diabetic retinopathy, which is moderate to severe in category. Exactly the kind of answer that I expected, right? So I think you can see the beauty of this. In fact, like this is a custom thing we have developed, but of course you can try this out at your own. Again with a little bit of prompting, you can use it in a GPT-4o also, and you will be surprised by how accurate it is in terms of the answer, right? So here is the answer, right? And you can clearly see the answer is quite accurate. Let's look at another case, right? Now here I have not used any custom thing. I'm directly using GPT-4o, which is available, to a lot of you, like I said. So this you can clearly see it's a Charcot's foot, right? So a 64-year-old male patient, long-standing diabetes, is complete loss of sensation of the foot. What is this deformity? What is the diagnosis, right? So this is what I asked. So I took this image, put this up in the chat GPT. Now in this I'm using a custom GPT which is available to paid users, but you can again use GPT-4o. Again, this is a little old. Now you don't need to use this custom GPT, but there's one which is very good called Medical Images Pro Enhanced. If you have access, if you have a paid subscription, you can check this out, right? So all I did was upload this image and ask this question, right? That this is the thing and what is the diagnosis. So here it says patient has deformity with long-standing diabetes. This is likely to be Charcot's foot, right? It gives you the right diagnosis. Also gives you why: collapse of the arch of the foot, swelling, redness and warmth, bony prominences, and all those things, right? So it is giving you a reasonably good answer. So it is able to make a lot of diagnosis with reasonable. I tried with a lot of dermatological images as well. It is quite good in terms of the diagnosis which it can do, right? Now let's look at it further. Does it help you in interpretation of clinical reports? So sometimes you have certain reports. For example, in endocrinology, we see a lot of pituitary patients and we see a lot of perimetry, right? Now, I'm of course, you're well aware about this, but at the same time, you also want more insights. Another thing which we commonly use and very useful for metabolic physicians is this, right? This is a Fibroscan. Okay, so you can see this Fibroscan picture. Now, when the Fibroscan first hit, right, and our hospital started, this is a image from February. And right now our hospital has a Fibroscan available for testing. And when we started using this Fibroscan, a lot of times I didn't know what this report really means, right? To be honest, right? I'm an endocrinologist. I order Fibroscans, but I don't know what the report really means. right? So the first time I actually tried it, I was actually pleasantly surprised with how accurate it was giving me the diagnosis. So this is the image so I just took this photo using my mobile phone, using my iPhone. I just clicked the photograph of the report, right? And then I just asked the again Medical Images Pro Enhanced, what is the interpretation of the Fibroscan report of this patient? This is all the prompt I gave, right? Nothing major. And you can see here the answer, right? You can see the answer here. So it says Fibroscan. It gives you the controlled attenuation parameter, right? The liver stiffness measurement, which is 4.9 kPa, and CAP says it's 284 with standard deviation of 9. This is all there in the report, right? In fact, if you see the report, it is all there in the report. And then finally gives you a summary, says that liver stiffness is this much, which is within the normal range, indicative of no significant fibrosis, and CAP score is 284, suggesting mild to moderate steatosis, right? So actually I then confirmed this with my hepatologist as well, and he's also quite in fact impressed with the answer. In fact, he also didn't know how to interpret a lot of these Fibroscan reports, right? Which is very interesting. Okay, so this is the thing, right? So it can actually, and I think now I very commonly use this to interpret Fibroscan reports very commonly, right? Because this is something which I don't have to remember the values. Anyways, you have thousands of values to remember in your brain. Why remember one more value of the liver stiffness and CAP score? So all you do is just take the image and upload it on ChatGPT, and it will give you the answer, which is quite accurate. Then of course, sometimes we are stuck with clinical queries in our mind, where you require evidence-based, questions, evidence-based answers for that. So it can help you answer clinical conundrums. So this is one thing we have developed called the Indian Adult Vaccination Guidelines. We have made a custom GPT of this. This is currently available on this website, adultvaccineindia.tiny.site. Okay, this is made by us, made by me. Again, it does not take more than, it just took me half a day to make this, half a Sunday. A lot of these developments are half Sundays development, right? This is not something where I spend hours making it. This is something very easy to develop also. So here you can try this out. You can check this out. This is unless the website is taken down, it's still available. Now, why this? Because again, a lot of the times, again, a lot of you are metabolic physicians. You will have patients where vaccines are very important. Adult immunization is very important, especially pneumococcal vaccines and influenza vaccines and Shingrix also. So a lot of these vaccines are very useful for your patient, right? But who really remembers these vaccine schedules, right? When to give it, when not to give it, what are the indications, contraindications, all these things, right? So there is Indian vaccination booklet. So a lot of this is made based on the available literature here. So here you can say, this is a question I asked. My 32-year-old patient has type 1 diabetes. What vaccine should be given? Should he be taking, right? So this is the question. Again, you can see a spelling mistake, but that's okay. Even then it answers. So this is the answer. Influenza vaccine, it has to take annually. You have to take annually. Hepatitis B, 2 doses. TDAP, pneumococcal vaccine. Now, this I didn't know actually. So again, I went back and read it. So PCV 13 followed by PPSV 23. In fact, since type 1 is a high risk condition, patient actually requires both the vaccines. COVID-19 vaccine annually, MMR, chickenpox, and shingles. These are the vaccines which the patient should be taking, right? So that is what, unless the patient has already completed the course. You can then, of course, it's a chat, so you can keep asking, okay, what if my patient has already recently taken a first dose of chickenpox vaccine? Does the patient need to take it again? If the patient is fully vaccinated for hepatitis B, do I need to give it again? So these are the things which you can ask your patient. You can talk to your patients. You talk to the chat GPT, to the custom GPT which you have made, and it will be able to answer this question, right? So these are some clinical conundrums which you often face. Same way, let's say you want to ask whether my patient requires aspirin or not, whether my patient should be given statin or not. You can ask these questions. You can have the guidelines answer the things from the guideline as well, right? So these are all some of the use cases which are very common. Now, another very useful case, and this is something which is very time saving in my practice, is this, right? So you have a lot of these patients sending you these reports, right? We all have this annoying patients who send reports from this websites where they do a panel of tests, right? Especially again, if your practice is primarily related to internal medicine and so on, you will be seeing a lot of patients with a lot of these reports, right? Big 28 pages. This is a 28-page report from 1mg.com. Okay, most of the tests are garbage. Okay, that is what, having said that, right? But this is what the patients bring, right? And then very interestingly, they never bring a printout of that because it is 28 pages. So they just bring you the PDF, Okay, so okay, sir, this is the PDF, right? And the mobile screen is very small. You have to strain your eye to really read the report, right? So that is a it's a painful procedure. I'm sure a lot of you would already be having pain thinking of this process, right? Let's reduce your pain, right? Very simple. All I did was made a very simple prompt. Just extract the following details from the report. Make sure you don't give the patient's name, right? You don't want to put that up. So you can see, I just want these reports. I want the fasting sugar, I want PP2BS, HbA1c, creat, lipid profile, TSH, urine albumin creat ratio. These are the reports I want. I don't want the chromium and cadmium and beryllium reports, right? I just want these reports. Okay, so this is what I did. So you can see the answer, right? So you can see it gives you the answer. Fasting is this much. HbA1c, I think you can see from the image also. Okay, here you can see HbA1c of this patient 7.6. So it gives you the answer 7.6. Now, what is interesting is this little these little notations it has. These are the citations. Actually, it will exactly tell you from where it took this within the PDF. Also, it will tell you from where it took this data. So you can go and cross check it also, right? So this is it's that accurate. This is GPT 4.0. Okay, it's the latest version. It's again you can clearly see each of these things. It is giving you where it took this data from, so that you can go and cross check, so that there is no hallucination. A lot of people talk about this word hallucination. I think in today's modern GPT models, hallucination is actually very, very rare. It actually this is all explainable AI. You can actually go and cross check and cross verify the reports, and you will also be surprised how accurate it is. Then something again which I am developing, as I have been developing for a long time, right? So this is not one Sunday development. This is something which is weeks and months of development. Again, very useful. Again, we'll make it available to general public soon. It's still in a beta testing, or alpha testing phase for myself. To use virtual agents in your practice, right? And I think one virtual agent which it always comes in my mind is virtual dietitian, right? So of course, we are dietitian in a hospital, but of course, sometimes dietitians and nutritionists are very good. They make your practice smooth and very good, but sometimes it becomes a hassle as well, right? So sometimes your advice for diet, and diet is such a tricky area that you can often, if you do it right, your practice grows. If you don't do it right, sometimes it can lead to problems, right? So we have created a virtual dietitian where it tends to give you a lot of insights amongst your patient and your patients also. For your patients as well, it actually stops your patient from asking too many questions about diet, and rather leaves it to the virtual dietitian to give a more detailed and a nuanced answer, right? So this is a virtual dietitian. We start with some onboarding process where you collect some patient data, right? The email address and all that. This is just for collecting data. Age of the patient. Now, what we have done is we actually started taking some interesting. So, for example, describe your dietary preferences. Okay, so this is what we said. Also include area where you live. Now, for example, I can take an example here. I am a vegetarian. I do eat egg occasionally, right? So these kind of things. And then I live in Gujarat. So I don't want you to suggest food items which is there in Bengal, right? I'm not going to go to Kolkata and buy those things, right? Again, you can mention your allergic to peanuts. So the more detailed dietary preferences, you can say I want Mediterranean diet. You can say I want low carb diet. I want very low carb diet. Whatever, right? That's up to you, right? You could have religious restrictions and so on, right? So you could say I take Jain food. Again, a lot of you are from Mumbai. Would know that Jain food and Swaminarayan food and these kind of dietary preferences also you can cross check, right? So here I can say I'm Jain. I'm strict vegetarian. I have no food allergies. I come from Gujarat. These kind of things. So you can put this up in the thing, right? Okay, then a little bit about medical history. You can give, again ask the patient to give some medical history. I have type 2 diabetes, so on and so forth. Obese, I am hypertensive, so on. Describe your level of physical activity. I exercise every day. I go to the gym, so on and so forth. Okay, a little bit of anthropometry, height, weight, waist circumference. These kind of details, right? And then it takes you to choose your option. Here you can, yeah, so you can do three things. You can do generate a diet chart. You can ask questions related to the diet, and you can upload food photographs for analysis, right? So let's say we said we want to generate a diet chart. So here it generates the diet chart. So I said I want an intermittent fasting type of thing. So it gives you the intermittent fasting type of diet chart. Post fasting at 12 p.m. this is what you should eat: vegetable moong dal, mint chutney, salad, and so on. And then you can actually ask questions, and you can get it modified. That I don't like dal chila, right? Give me something else, right? So patient can always have this option. Maybe have at 3 p.m. have a fruit and some nuts and so on, right? So it generates a diet chart for the day, and gives you some dietary advice also. If you look down, it says these are the things, avoid high sodium food, opt for low glycemic index food, high fiber food, and so on, right? Of course, this is still only in English, right? But again, maybe you can have it in local languages also. You can say, you can see Gujarat. I said, so it said Gujarati kadhi is something you can have. So these are the, this is the development, right? This is a virtual dietitian. You can try developing some of these of your own using ChatGPT. Also, you can directly, in fact, not use anything and just start generating diet charts for your patient using GPT-4o. And this is something which is very easy to do. Okay. Finally, one interesting thing which I developed, again, this is available to you. You can, if you have an iPhone, you'll need two things. You'll require an iPhone, and you require a GPT-4, GPT Plus subscription, because I tried it without the subscription, it doesn't work that well, right? So I made a very useful, this is called an Apple shortcut. So some of you who use an iPhone probably would have seen using an Apple shortcut. So what this does is this actually summarizes your clinical studies in a very nice, crisp manner. Okay, so you'll see that. I'll give you an example. And so we are part of a lot of these WhatsApp group. For example, this CME India group is something very popular. So a lot of people share, studies. This is published in NEJM. This is published in Lancet, right? So who has the time to read all this? Nobody, right? That's the reality. So, for example, this is a very interesting study. This is about association between tomato consumption and blood pressure in cardiovascular risk. So, very interesting study. But I didn't have the time to read the whole study. Didn't even have the time to read the abstract. So I made this, a shortcut. So what it does is you just have to share this PDF to the shortcut, right? And what it will do is it will take a few seconds. Just take a few seconds, and it will then generate. I'll show you what kind of answer it generates. It saves this answer to directly to the to my notes application, right? So this is the summary. Title of the article, first two authors, one line summary of the article. The study investigates relationship between tomato consumption and blood pressure in older adults. Okay, 6 key points from the article. Study population, tomato consumption measurement, blood pressure, hypertension, statistical analysis, nutritional benefit. Okay, practical take home message: incorporating tomatoes in diet may help reduce the risk of hypertension, especially for older individuals. That's it. This is all I wanted to know, right? This is all I wanted to know. And then you have a citation also. Let's say I'm using this for my presentation like this. I can use the citation, right? And then finally says that this is using this, right? So it's freely available. You can scan this QR code, and you can just it adds this shortcut to your shortcut library in your Apple. And what you have to do is you have to take that PDF and share it with the shortcut, right? So share it with the technicalized shortcut and just give it a few seconds, and it will give you this. It will generate this entire thing and store it in your Apple Notes, right? So again, when you're, let's say, traveling, you don't want to read it. You just do this process, and when you reach your clinic, right, you can then, all the things are there neatly in your Apple Notes, and then you can take a few minutes just to read the articles that are shared, right? So this is all for today. Okay, I hope you found this very useful, and you can follow me on Twitter, and you can follow me on LinkedIn. I think the best place to connect is actually LinkedIn, right? This is where I generally get all the things well filtered, and so this is where you can connect to me. You can just search for me on LinkedIn. And if you have any questions, I'll be happy to answer them on LinkedIn as well. So thank you for a patient listening, and would be happy to take any questions and suggestions and discussion points to take this forward. Thank you, sir.